No matter who you are, no matter where you live, everyone is affected by the crisis of overdose. Imagine each dot represents a human life. This is how many people die of fatal overdoses across the country each year. It's more than 100,000. That's one person every 5 minutes. Before this timer ends, another person's life will be lost to overdose. The United States war on drugs is more than 50 years old, but the numbers show that punishing people who use drugs was never a real solution. Overdose fatalities have been steadily increasing for over 20 years. When you look closer, the scale of the overdose crisis becomes clear. In North Carolina alone, 11 people die from overdose every day. 80 people die from overdose every week. 325 people die from overdose every month. Last year, over 4,000 people in the state died from a drug overdose. Overdose deaths in North Carolina have increased by almost 225% in the past decade. In Black and Indigenous communities, the statistics are even more alarming. Since 2015, opioid overdose deaths among Indigenous people in the state have increased over 400%, and opioid overdose deaths among Black North Carolinians have tripled. Geographically, rates of fatal opioid overdoses are now higher in the state's rural counties than in urban areas. Fentanyl contamination has led to rising overdose rates among users of almost all illicit drugs. These lives are more than just statistics. Every person lost to overdose is missed by the people who loved and cared about them. Our loved ones who are missing deserve to be remembered.
How much heavier is the heart to know that we lost one of our own. The world was brighter with you in it.
Dear bro, you didn't deserve to die. If only I knew then what I know now. But I promise you, I'm doing my best to help others. I love you always.
I'm sorry we didn't understand you. I'm sorry we weren't there to help you. I'm sorry society failed you. We miss you, Mom.
This is my baby sister. I always thought there would be more time. Time ran out. You mean the world to me.
Mrs. S., I wish there was a way to go back. I wish so many things. Love you, brother.
Each overdose death is tragic and preventable. It's become clear that harsh laws won't save more lives. More arrests can't end the overdose crisis. Drug use is a public health issue, not a criminal one. While community health services are drastically underfunded, the United States spends billions of dollars per year enforcing the war on drugs. Across the United States, communities are responding to this crisis by implementing the principles and practices of harm reduction. Harm reduction is a practical, proven method to prevent overdoses and save lives. By providing critical supplies, information, and healthcare, it reduces the risks associated with drug use and improves the health of local communities. Through harm reduction programs, people who use drugs can access naloxone, a drug that safely reverses the effects of an overdose. Safer drug use supplies, such as sterile syringes to reduce the spread of HIV and viral hepatitis. Drug checking supplies and services. Medication treatment, such as buprenorphine and methadone. And other stabilizing health services. Harm reduction treats people as people. Everyone is worthy of dignity, respect, and understanding. People served by harm reduction programs are 5 times more likely to find drug treatment that works for them. Together, we can end overdose. Harm reduction works to improve the health and safety of people who use drugs. Support harm reduction services in your community. Get naloxone. Carry it wherever you go. Learn more about harm reduction and share your memory of a loved one lost to overdose at www.supportharmreduction.org.